As an eye care professional, we get to look into somebody's eye. We can see their blood vessels in action. I like to explain this because if you see a family doctor, your GP, your primary care provider, they usually have to draw blood and test your blood to know what's going on. They can't just look at your arm and tell how healthy your blood vessels are. But I can look inside the eye and actively see your blood vessels and the nerve, right? You can't just look at somebody on their face and tell how healthy the nerves are of their neck, their face, but I can see the nerve. I can see a direct connection to their brain. And so there's something beautiful about that, and ultimately just how important getting eye exams are. As a young boy, I got into glasses around the age of 7, 8 years old, and never really loved wearing glasses. I didn't like the feel of them on my face. I didn't like how I looked in them. And then when I turned about 13 years old, I wanted to play sports. And it's hard to play contact sports with thick glasses on. And so my mother, she wore contact lenses. And so she brought me in to see her eye doctor to be fit into contact lenses for the first time. And it changed my life. I had a boost of self-confidence because of my appearance and having more friends. And so the most important thing in my life, I think, as you can imagine, a 13-year-old boy, girls started liking me. And so I never really loved seeing my dentist, for example, but I loved seeing my eye doctor. I thought it was like black magic or something. So I knew that I wanted to do that job. And so I set my eyes on it, and that's where I'm at today. I went into eye care thinking I would just be a clinician, that I would see patients every day, fitting them for glasses, contact lenses, treating their eye diseases, glaucoma, diabetes, all these different eye conditions. But I found out pretty soon after my residency that so many of my patients, I didn't have the time to fully educate them to the degree that I knew I wanted to really help them. And my patients often had questions that I knew in order for me to explain, I needed visuals. Because the eye, there's a lot of details that it's hard to understand unless you can really see it. And so I found that there wasn't many eye care professionals online, and there wasn't really a TV show about eye care. So I thought, well, if anyone's gonna do this, I'm gonna do it. And so I started my journey making educational videos all about the field of eye care. My main channel is on YouTube under the name Dr. Eye Health. We are now over about 1.3 million subscribers on YouTube. I've never liked the term influencer. I've always considered myself as either an educator, because I'm not showing up to really talk about my life. I'm not showcasing me driving around in a fancy car or showing off a big house or anything. I'm more truly trying to answer people's questions, trying to deliver education to really solve a problem and be a resource for people. Right now, probably one of the biggest focuses in the industry of eye care is the concerning increasing rate of myopia, or otherwise nearsightedness, where when people look up close, they can usually see fine seeing their phone, but when they look in the distance, everything is blurry. And so we see this increasing rise in the amount of children who are nearsighted, and to greater degrees. So they're not just 1 or 2 diopters nearsighted, they're becoming 6, 7, 8, or higher. And some people may think, oh, that's not a big deal, they just need new glasses. Well, the eyeball stretches and gets longer in that disease. And so their risk of other age-related eye diseases, whether it be cataracts, having glaucoma, having a retinal detachment where the retina pulls off the back of the eye, and even what's called myopic maculopathy, these all conditions dramatically increase the risk of vision loss in their life. And most of this condition is related to lifestyle, of us not only being indoors more often, but also because we're spending so much time doing near tasks. And so right now there's a lot of research into what we can do lifestyle-wise to help encourage our children to spend less time up close and spend more time outside, but also for treatment options to help slow down this fast growth of the eyeball in the condition of myopia. On average, across the globe, people spend 6 to plus hours a day on just a computer or laptop screen. If you include all of the time you spend on phone screens, from the moment you wake up to the end of the day, it's often over 11 to 13 hours a day. And so that does strain the eyes. Our blink rate decreases. Often we're in poor ergonomic positions. Our shoulders, our neck are not in good positions. One of the best things you can do is to take a frequent break. And it's not just to wait until you're tired or exhausted to take a break. It's best to systematically schedule breaks about every 20 to 25 minutes or so. And it's not to take a break for just 20 seconds. It's actually better to go closer to about 2 minutes or maybe even longer. I personally like to go take a 5-minute break and get outside. I get some movement, I change position, stretch, get some water, use the restroom. Or if you have a colleague or a friend, whether you're working at home or at the office, go talk for a little bit, get up, get some movement. But it's not just a break for your eyes, it's also a mental break. You will find yourself being more efficient and more productive. Unfortunately for a lot of our patients who do neglect their eyes, they neglect coming in to see an eye care provider. Usually it's because they feel their vision is fine and they've never really struggled. By the time they do come in, whether because they start to notice something changing or maybe a loved one encouraged them to finally come in, it's usually too late at that point. And oftentimes we detect other diseases. Again, things like maybe they have swelling in their retina or bleeding from diabetes or high blood pressure, or perhaps their optic nerve has slowly been dying for a few years because their eye pressure's elevated and they have a diagnosis of what is called glaucoma. And so the eyes, our bodies prioritize having our vision be functional and good as long as it can, because it's essential to our safety, to our performance, to our quality of life. And so these diseases, they don't really show themselves, or you don't have symptoms of it until it's too late. And so that's why it's so important to have a regular eye exam, so we can catch it early and prevent vision loss. Best food for the eyes. Carrots are certainly beneficial for many reasons. Beta-carotene in carrots is ultimately converted to vitamin A in your liver, and that helps with the eye health. However, eating more carrots isn't going to give you sharper vision. In fact, eating green leafy vegetables like spinach, kale, eating your salads is in fact probably even way better for your eyesight, because some of the micronutrients in those products deposit specifically in the eye and help protect your eye and also help reduce your risk for aging eye diseases. The eyes are, as we've always said, it's kind of a window to the soul, right? But it really is a window to our health. The eyeball, the retina in the back, is the most metabolically active tissue in the body, with the brain just right behind it. And so if you have an issue with your blood, if you have an issue with your metabolism, we can detect that inside of the eye. If there's something going on with your liver, it can show up in the eye. There's so many different ways that we can detect other diseases that are going on. And so again, that's why it's so important for us to be prioritizing our eyes, our health of our eyes, and to be seeing an eye care specialist on a regular basis.